Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Stephen Poletti. He is a spine surgeon here at East Cooper Medical Center. Thanks for sitting down with us today.
Thank you.
All right, so first off, you're with the Southeastern Spine Institute and, here at East Cooper. Let's just talk about kind of, these days, people with technology and things like that, they think automatically you go straight to surgery and things. But y'all like to take a more you evaluate the entire patient. You're not going to just go cut them open immediately. Talk about kind of your process. If I'm a patient, I'm coming to see you for the first time.
Right. Well, if you look at the patients we see at Southeastern Spine Institute, 90% don't have surgery. So 90% of the people that come in to see us in the office can have their back problem treated with a process other than surgery. Most people are familiar with physical therapy. Obviously, medication can have a role. And then sometimes people can consider injections in their spine, some type of cortisone injection, much as people might have a cortisone injection in their knee or their shoulder. But you're exactly right. We would avoid back surgery unless you have to do it or unless you've failed everything else. And so, again, back surgery tends to be the thing that we try last, not the thing that we try first.
So here's something. I know I did shots in my back years and years and years ago, and then I ultimately had to have surgery. But can you sometimes avoid that? Can sometimes just a shot work, or is it inevitable when you get to that point?
Right. Again, many people get better with non-operative care. Most of the people that have an injection or have therapy don't end up having surgery. The odds are with you that you won't end up having surgery. 90%,
that's pretty good odds, right?
And if you have to have surgery, almost always you know that you have to. There's some trigger that's gone off in your head that just tells you that you've got to do something. And most of the time we can avoid that.
And you can avoid it, let me tell you, by going to see someone way sooner, right? Because we talked about that in one of our previous segments.
Right. The earlier you get in, the quicker you have your problem evaluated, the more likely it is to get better without surgery.
All right, before we head out, just talk about what makes Southeastern Spine Institute different from everything else.
Well, Southeastern Spine Institute is the only practice in South Carolina that's exclusively dedicated to one body part, right? Exclusively dedicated to the spine. And so we have doctors in different subspecialties. We have orthopedic surgeons, neurosurgeons, neurologists, anesthesiologists, pain medicine physicians, neuroradiologists that all work under the same roof at the same building. And so what makes it unique is doctors in different specialties only treating one body part, only treating the spine.
That pain specialist, that's a very important thing, especially this day and age, right?
Right. Pain specialization is so important, especially these days when we're trying to manage people's pain by limiting medication.
Alrighty, well, anything else we need to know before we head out? Let's say we want to come see you. Do we need a referral? How do we go about that?
No, you don't need a referral to be seen at Southeastern Spine Institute. You can pick up the phone and make an appointment with any of the doctors. We'd be glad to see you whenever.
Alrighty, well, thanks again for being with us today.
Well, thank you so much.
And for more information, head online to eastcoopermedctr.com.